I have Dan Partridge, and I had an opportunity to listen to him last month on a video series that we did, a webinar series that we did on Public Health 3.0, and we know that one of those themes is building leadership and infrastructure, and branding is part of that. And he talked about the magnificent work that he was doing within his health department on a branding strategy and really institutionalizing that. And so I asked him if he would come here and share that information with you guys today on his best practices. And just to give you a little bit of background on Dan, Dan has worked in local public health since 1991. And then in 2007, he actually became the administrator of Lawrence Douglas County Public Health, located in Kansas. And prior to that, he served in Reno County Health Department, where he served various roles, which included Administrative Service Supervisor, Associate Director, and Environmental Health Supervisor. His background is he does have a master's degree in public health from University of Kansas School of Medicine at Wichita in 2007. And he is also a graduate of the Kansas Public Health Leadership Institute. He has served as a Kansas Association Local Public Health Department President and also the President of the Kansas Environmental Health Association. So with that, help me welcome Dan. And I'll turn it over to you, Dan.
Thank you. I wanted to provide a little context before kind of diving into the branding message that I will deliver today. I think the context is important because to tell the story, you need to start at the beginning. And the beginning for me was 1991, as mentioned, and I didn't get into the field intentionally. Really, it was, hey, here's a job that would get me back to my hometown where I could raise my kids with the values that I had as growing up in Hutchinson. And so I just got into public health not really knowing what that was about. And in that, first couple of weeks, you'd tag along with different folks. And this was the story that I heard that stuck with me. When public health does its job, no one knows we're here. And I thought to myself, because I came from private industry, wow, that's crazy. I don't know of any business that would be proud to be invisible, and certainly not a good business model. And then the other thing I heard in that kind of first pass through the health department and hearing people describe their work to me was that they felt powerless, voiceless, didn't know how to talk to their county commissioners, and really kind of avoided it. And again, I thought, gosh, that doesn't sound like a pathway to success. And so that was the seed that was planted in me in 1991 when I started in public health to say, gosh, we need to find our voice. We need to know that branding and communication is core, central. Without it, we will perish. So it's been part of what motivates me and drives me, because also what I learned in those first 2 weeks is I got a sense of enrichment and fulfillment that I never had gotten in private industry. The sense that you were able to give back to people, give back to your community, and the way that public health practitioners can, really has kept me in the field and motivated me to move onward and be where I am today. Because I love the heart and the spirit of public health. And I love the message that we can tell, we just need to tell it over and over again. So that's a little of the personal context, organizational context. This is a picture back in 2015 when we became an accredited health department. Accreditation had rolled out, I think probably about a year before was when the first cohorts started getting accredited. And that was a kind of top of the mountain experience for us. We started climbing that slope really back in 2007. I remember that first week at the health department where I am now in Lawrence Douglas County, where I I said to the staff on that very first day, here's our mission. You know, we have an awesome clinic, and that we were known for that. That was our brand in 2007. We provide high quality clinical services. And everything that they did was of high quality. But there wasn't a true community presence. And I said to them, our work is in the community. We need to figure out how to make that journey from clinic to community. And also in that first week, as you kind of have lunch with this person and that person, I was having lunch with the city manager. And we barely put a fork to the plate, and he said, you know, Dan, I just want to tell you, I'm going to be up front with you. I really don't think it's the city's mission to fund a health department. And that's going to be my mission, because he was a new city manager too. I said, well, that's good to know. I hope you'll let me tell my story. Because he was new, I was new. And then 2008 hit, and if you've been around since then, you know what 2008 was. And so that was tough times. And you know, in all of that, and in response to some of those economic pressures, in the state of Kansas, the public health landscape changed. Where before, when I started in public health, there were 12 city county health departments in Kansas out of 100. Right now, there are just 2. Because that was one of the ways to cut your budget in tough economic times as a city, was to get rid of funding public health and saying, you know, Kansas statutes say that it's your job, county. And so that happened a lot. And I didn't want to see that in Lawrence. I've always felt that our structure as a city county health department, our autonomous and independent health board, is key to everything we do. And we needed to make sure we could preserve that. And I would say that's a battle that we get up every day to fight. We haven't won it yet, the war, but we fight the battle every day. And part of it for me in that answer is, you know, it's the community that is our buffer. It's the community that is going to say, we like this, it works for us, we want to preserve it. And if they say that, then that's what will make it happen. Not us, you know, as staff saying, well, you know, here's XYZ reasons why it's good. Our voice isn't really the pivotal one, it's the public's voice. So we needed to get our story together and get it out and get that public on board. And so the very first thing that we did was say, let's write our story. So we had a retreat with our board and staff, all of our staff, and together we wrote a story that talked about our past, our present, and our future. And I don't have it here, and you'd find it on our website if you go there. But that future story has 5 bullet points in it, which have stood the test of time and is resonated and reflected in our strategic plan and all of the work that we do. And part of what it says is we want to be a trusted source of information. We want to use and apply the evidence base and help others do that. We want to be a convener, and we want to make sure that we serve everyone and we do so respectfully and appropriately. And so it was our kind of device to have that message to staff that was creating that first common theme. So every new person that comes on board since we've created it gets that handed to them by me, and along with a story about the importance of storytelling and a request to read it. That's their first homework assignment. When they go home that night and their friends and family ask them, how was that first day at the job? What do you do there? That they'd have something more than just, oh, it was okay, or so-and-so was nice. They would have something that started for them to be an ambassador for public health. So a little bit of the technical pieces of branding, just to maybe take a jump a little bit. A brand is not something that we get to decide what it is for your department or for your institution. It's really what the public decides that it is. That's message number one. The public sets your brand. Your brand should be your promise to the community. And so your promise ought to be what people perceive when they think of you. And a good brand creates a mental picture for folks. It creates a personality. There's a personality to it. There's some vivid mental imagery to it. And then a good brand also is consistent. So these are just nuts and bolts things that I think it's important to acknowledge when you think about branding. So our promise is in the tagline there, healthier together. So when we put together information and we talk to people, the message is always that we're about health for all in this community, and we can't do that job alone. It takes all of us. We are healthier together. That in a nutshell is our promise and what we say we're about. And it's something that staff at our health department will say in their own words. So I want you to just maybe spend 20 seconds here thinking about what is your promise for your organization. What do you promise your clients and communities? How many of you had something come in your head? Any brave soldiers wanting to volunteer? Go ahead.
I always have a big mouth. So I work for a health system, and our general motto is make medicine better. And as our department, we go to schools and talk about prevention. So we're making the lives of kids better, in my opinion.
Okay. Do you have any idea of how the public perceives your promise? I mean, what they would say about you?
Some segments of the public, I think, we do a school nurse conference, and I think they would agree. Maybe not the whole system making medicine better, but I think they would agree that the programs that we do in schools help kids make better decisions about their health. But I don't know that for sure.
Okay. I'm just kind of maybe pounding the point a little bit here. Making sure that your brand is your promise to the public. And then you have to make sure that you keep that promise. And this is just this is a resource I go to a lot. It's quick, it's easy. brandingstrategyinsider.com. So if you're curious about what others might tell you or about it, you can go there. I said that the public sets the brand, and that really is true, because sometimes we can get frustrated and say, why don't they just get it? Or they just don't understand. And the secret is, or the challenge is that, you know what do we have control over? We can't control the public or whoever it is we're trying to get that message conveyed to. So we have to decide, well, we either have to simplify our message, reframe the message, connect to people's values in a different way, do it more loud, more frequently. We have to change something. We can't just say, you need to figure out how to understand me better. So the onus is always on us to try to help the public understand what our promise is. And here's the secret, what I say to staff too. Every day, with every encounter, with every person you meet, you are setting our brand. That's the thing. It's those thousands of little things that really, in the end, set your brand. You can't really do the big things if you're not doing the little things well. And so it's important to us that every client experience goes well. And about 6 months ago, we do a client satisfaction process where we give a tablet to every person that walks in our clinic and say, tell us how you did. And we ask them to tell us about how well you were treated. Did we give you the information or service that you needed? Did we treat you with respect? 4 basic common questions. 98+% of people give us a good or very good response on that. And I'm really, really proud of that, because you can't get 98%, and that's over about 1,100 responses, without staff truly living that every day. And so kudos to our staff for being our brand makers. They truly are our brand makers. It's not the, it starts there. And if you don't have that, you can't go any further. I kind of just said that right there. But here's the other things too about a brand. You need to know what sets you apart, what makes you unique in the community. And not what you think, but you need to make sure you're asking the public the question, what makes the health department unique, or what makes wherever you work unique. You need to really be in tune and in touch with the public. And so part of what we've done in our journey is do customer intercept or public intercept surveys, where we'll have college kids just approach people at grocery stores and see if they'll answer a few questions about what they know about the health department. And so it's important to try to do some of that, so that you know whether what you're saying is what people are hearing. And then the other important thing that I believe is that whatever you're saying, if it's in dissonance with how you act and behave and treat people, those relationships that you've built, if they're not congruent, it's not going to work. When we say we want to treat people with respect and it's all about relationships, because that's another mantra that we have, is that we're in the relationship business. But if people don't believe that, they're just going to say, forget you. So we have to make sure that when we say we're in the relationship business, that our partners believe that too. So part of what we do is we do have a partner survey, where every quarter we send out surveys to a sampling of our partners to ask them 12 questions on how well we're treating them. Are we listening to them? Do we respect their opinions? Do we let them, have ownership of problems, or do we just take over meetings? Because we want to be conveners, not just, the chief in charge. So we asking all of that. Another thing that I think is one of those little things that if you don't do this, it's hard to do the bigger things. And that is, that first health department I worked at, when the paper called or the radio station called and wanted a story, oh my gosh, everyone was headed for the hills. Nobody wanted to take and be that interviewee. And I'm going to have to take a tangent here because it's just the way my head works. One of the things I walked into at the Lawrence Douglas County Health Department was we had a communications coordinator when I got there. And that was a position I hadn't seen before in public health. And I thought, wow, this is really cool. It's, stepped into a good spot here. I asked about, well, how did it come to be that we had a communications coordinator? And the story is, well, in 1996, I believe it was, John Franco might remember, there was a big cryptosporidiosis outbreak in Lawrence. And the newspaper just was crucified the health department on not being transparent, not, having the public's interest at heart. And when the dust settled out of all of that, the city and county asked the director at the time, because they knew that it was a fairly traumatic experience, what can we do? What do you need? And her answer at the time was, I need a communications coordinator. I need someone to help with that public messaging. So that's how we got one. I still don't know if there are other health departments, maybe. So I would say that, that's a great position. I think it's a critical position, because what she's trained us to do, what she's forced us to do, is to not just take the call from the news, but to put everything else aside and make it your priority. You know, she will hunt you down and make sure that you respond, because she was a former, she worked in the newspaper industry for about 15 years before joining us. And she knew that one of the easiest ways to be on the naughty list for a journalist is to never return calls. You know, they're under a deadline. They need to get a story written. And so we've become, because they know if they call Carrie, she will make someone return a call. Carrie is now the first person they call for just about anything. And so what that means is that when a public health story comes up or they want to do something about a health event, the hospital spends lots more money on media relationships than us. They spend lots more money on paid advertising than us, but they call us first. And that's invaluable. Back when we had a local television station, we were on either the radio, the television, or the newspaper on average every 1.6 days. And that's because, you know, they need to crank out content and they need someone to quote, and they could count on us, and that's all free. So that's I guess another tip down in that earned media piece there. It can take you a really long way. Yeah.
Is that position different than a PIO, a traditional PIO at a health department?
Well, she serves as our PIO, but she does a little more than that.
Value add?
Part of what she does, you know, not only does she make us respond to media, she doesn't say no either. So she will do a lot of writing for different magazines and newspaper inserts. So like the hospital, they pay to have a magazine put together quarterly. And they need to write content too. So we write content for the hospital. It gets credited to us and to Carrie in the health department. So we write content for other people because, you know, the newspaper industry has changed. They don't pay people to write for them anymore. They go find people like us to write for them. So do that. You know, take the time to do that. And you know, that's why I say Carrie's important, because even for me, you know, okay, do I really want to give that story that's not, you know, on my top of to-do list an hour today? So, you know, we have to figure out ways to keep motivated and encouraged to do that. I think I flipped this thing. So back on some of the little things. Part of what I believe is, again, that the brand is set by our staff every day with every person, with every interaction. And the only way, to me, that's not the only, the way I prefer to make that happen is to pay attention to culture and values. And if we have a culture that sponsors, that we've, and values that say, this is just who we are and this is what we're going to be about, then that's the best way to build a brand, in my opinion, because then that honesty is baked in. Because if it comes off as insincere or disingenuous or self-serving or, you know, whatever, it just isn't going to work. So we focus on culture and values. And so, again, not only are values talked about when people get oriented as a new employee, it's what they get evaluated on every year. It's what we ask them to do as we go through a performance appraisal system, and they go through, you know, they put together their own growth plan. That's all needs to be connected to our values. And we want to create a culture. It's always in the back of my head that part of the culture that I want to see at the health department is that not only are you an employee and you're there doing your job, but you also have this social contract with the community to give back. And so we set up, and to do that, we set up things like we get teams together to go ring kettles for the Salvation Army, or we will do all different kinds of fundraisers for the community on outside hours. So that's just some pictures of our staff here, ringing bells and trying to make, that is branding. When people know who you are and know that these are health department folks out doing that, that's telling our message. And then, again, this is a nurse that's as passionate as anyone I've met about the importance of vaccinations and vaccine preventable diseases, and loves kiddos. And so that picture, I think, is one that we've got up on our walls. We use it in our products that we push out. I guess that takes me to another little tip. Take lots of photos. I mean, I think I haven't counted them, but I know we have probably between 400 and 500 photos every year that we have in our little directory of things that we've taken of our staff. We also, not only do we want to be values driven, but we want to be purpose driven, because every program has a purpose statement the goal of that purpose statement is to describe in real terms, in terms that, or words that come from the heart. Why do you do what you do? And who do you do it for? And what outcome are you trying to achieve? Overall, at the department-wide level, our purpose is to create an equal opportunity for health for all. It's that health equity frame that everyone here is, familiar with. And that first picture that I started with, that's pretty much our entire staff. That's about 42 folks trying to serve and create health for 120,000. And so I'm always appreciative of the fact that with 42 staff, if we're not working all together, all in the same direction, all rowing together in unison, we're not going to get there. So that's the little nuance there in this achieving you or our goals. Your personal goals and our organizational goals have to be aligned. And, we talk about that. We invest a lot in making sure that the supervisors that we have and the staff that we have like each other, understand each other, relate to each other. We'll talk through tough things together. Part of how we do that is we invest a lot in leadership. In Kansas, there's a really great resource called the Kansas Leadership Center, and 75% of our staff have gone to training there. Our commitment is that we will send anyone who wants to go to training. And that's not cheap. I haven't asked, well, I did ask, I haven't got the report back yet. How much have we spent with the Kansas Leadership Center? I'm kind of afraid to know what that number is, because that wouldn't be a cheap number, I'm sure. Then the last thing, as part of our brand, we have to be focused about getting better every day. It's at least part of the internal brand. Lastly then, leadership has to be accountable. We have to be rowing in the same boat and doing the right things too. So for us, it's about saying that we will be transparent to you. There isn't hidden agendas. There aren't any questions that are off the table. And we're about giving and receiving constructive feedback. And then finally, it's about creating that supportive work environment. This is Andrew. He's one of our environmental health folks. And he's also in the Naval Reserve, and he just got back from about 7 months in Djibouti, Africa. So this was him at our going away party for him, and a little game about, do we know where Djibouti, Africa is? Most people did pretty good. It's right there. So he's telling us where it is. But anyway, the point there is we do lots of fun things, because if people don't love their job and don't love who they work for and have passion, then they're not going to be good brand ambassadors. passionate people who love what they do, they're great ambassadors. Back to rowing the boat and being values driven. This is the cover page of our current strategic plan, and the message here really is about everything you do, connect it back to the brand that you want to create. There isn't enough capacity or resources in public health to not just squeeze every bit of juice out of every orange or whatever. So these are our values as an organization: professionalism, integrity, compassion, teamwork, and this is our mission, to create health for all. And what I'm saying to staff here is, every day, this is our vision statement in a picture, because our vision statement is together, day by day, building a healthy community. Every day we get on this journey on our way to health for all, and as long as we're guided by our values, we will have confidence that someday we will get there. But we won't get there without struggle. There will be rivers to ford and setbacks along the way. And we don't leave it up to chance that people get that. We tell them that. So this is a way. It's a device to create a story, to tell, create a memory aid to tell your story. I looked at that and was able to tell you a story about the health department and what we believe in from that little simple picture. So those simple things, I think, are how you bake in branding into a health department. Then there are more technical ways, more traditional ways, which is, okay, in a strategic plan, usually it says, well, here's some goals and here's some milestones along the way, and here's a timeline for getting there, and here's who's going to do it. And so I just cut some bits and pieces out of our current strategic plan and then highlighted a few of them. So on this little section that I highlighted, all of those gold, to me, are indirect ways of saying, here's branding and it's connected to our strategic plan. So what's our strategic plan here? Well, the objective overall is that we want the community to get engaged in our community health plan and actually adopt strategies from that plan. So what are we going to do as a health department to help make that happen? Well, we're going to, try to make sure that policymakers understand that it's a community value they need to speak to if they want to be elected. So we do things like community candidate forums where we ask them how are they going to support the community health plan. We facilitate Live Well Lawrence. We just continue to convene meetings in the community. All of those things help brand what we're about, which is a trusted source of information, a convener in the community. The lighter yellow things there, those are the things that are like really direct. We're going to have communication tools to educate people. That tool of just the cover page of the strategic plan. We do that for a lot of other things too. Because if you want people to really pick up the work and own the work, giving them tools along the way is really what's helpful. About 2 years ago, we tried to, when we got accredited, let me say this, one of the advices opportunities for improvement that we were provided was do a better job of connecting your strategic plan to your performance management quality improvement system processes. And so we walked through with staff, how do we view our work? What are the building blocks of our work? And we used a balanced scorecard approach. So for us, it meant down here at the bottom, what are the assets we have as a health department? Well, a supportive work environment, a well-trained staff, adherence to professional standards. Those are the building blocks down here that I know it's hard to read. And then we're going to do things, in the middle about using evidence-based and collecting and gathering information and all that leads to this kind of choke point for us, which is provide actionable information. And my message in all of this is that as a health department, as we thought about, well, how are we going to frame our work and then measure it? Because for each of these domains, there are performance measures associated with it. But branding's embedded in all of that. You know, I've talked a lot about that supportive work environment. Time and time again here in the last 2 or 3 years when we bring in new people, they say things like, well, when I saw the ad or when I heard about the opening, I went to your Facebook page and wow, you guys have a lot of fun. You're doing cool stuff. You know, this week is Spirit Week at the health department. So yesterday was Silly Sock Day, and Tuesday was Twin Day, and so we're always doing those things, and people like that. I mean, over and over again, they say that's what made me want to come here. Was that it was apparent that you guys have fun and are a team, and so that's branding. That's the power of branding. It helps in ways that are unanticipated. So here's another question, and which is, what is it about your work that you want the public to remember? The power of relationships and the importance of trust building and being there for the long haul for people. And that can be tough in a public health department that you know, has only a limited bandwidth. And so I think you're pointing out the challenges of the vision, the dream, the aspiration, and then the reality and the gap between those. And so this isn't easy. It is hard work. It does take commitment, and I don't have an easy answer on how to do this well, other than you just always have to. It always has to be part of what you're thinking about, and how do you connect this to that to make sure that whatever you're doing, you're getting more than one thing accomplished. There's a video behind this, but the audio quality is low, and I think I am kind of running. I've got about 20 minutes left, is that right? Okay, so I'll skip the video, but the point I want to make here is that I've talked fairly extensively about how we went through a process of creating a story, helping the staff understand what the story is, living the story, not just, say, preaching it and then, walking away, but actually living it. But then you have to practice it. So this was a video where we just grabbed the old iPhone, turned on the video, and said, what is your promise to the public, or why do you do what you do? And people would answer, and then they get to see it. So the point is just practice telling your story, and not just you, but everyone in your organization. There's a lot of these kinds of slides, and I debated on how much time to put into them or how much to focus on them. I left them in because I think to me, it's insightful to see what just regular college students thought about public health. So what am I really talking about? One of the things we did in this communication branding journey was work with the University of Kansas Journalism School and their strategic campaigns class. It's like the capstone for journalism students. And essentially it's a semester, it's like their final semester where we are their client, and this is their pretend Madison Avenue. And so their job is to put together a branding campaign for the health department. But because this is also about learning, and it's a student environment, we did some things, in that setting as well, which is take these students around the country to places where we thought they would get a good story on public health branding. And so this is that first kind of kickoff meeting where we're their clients, and we're sitting there at the business table, and they're interviewing us as clients. So, okay, what are your goals? What do you want to get out of this? And they're practicing being that Madison Avenue executive. And what we said is, gosh, we need clarity in telling not what public health is, but what we do. And really it's about, so to me that's about not the concept or whatever, but what's the action? What's the verb part of what we do? So that was our challenge to the students. First place we went on this semester trip was we took them to DC and to NACCHO. They have a communications capacity there. They have a branding strategy there for health departments. And they got just versed in Public Health 101. While we were there, we went to see Senator Moran and talked to his staff about how to do branding. And some of the key points they took away were about keeping it simple, focusing on return on investment, and get rid of the techno speak and just talk about people. What's this mean to people? And I didn't give you a lot of context. So this stuff here, when they, at the end of the semester, what they did was give us here's the campaign, are you going to buy it speech? And they had it all scripted out. So this is Jenny speaking, and this is Joseph. So these are their words as they presented this picture to their clients, which is the health department and the health board. We went to Kansas City. Rex Archer is known as a proponent of branding and community health. He's that little trident thing, that's his deal. He talked a lot about to the students about the importance of co-branding, where hitching your brand with somebody else's brand, and the power of synergy, really. Bruce Dart in Tulsa, I think his staff and he really did a good job talking to the students about making it personal. Their focus there is say it's about you. When they say our job is to make sure that when you walk through our doors, we're going to take care of you. And it was that taking care of you, and then also taking care of staff. Those are things that jumped out to Whitney and Alex there. Then we took off to Kane County up in Chicago and listened to Tom there talk about the Cupcake Girl, which was really a story of what not to do, or the story about make sure you get ahead of bad publicity. Their experience was they go and shut down the Cupcake Girl who was selling cupcakes in her yard without a permit. And that made its way to Oprah, and their inspectors callously said the rules are the rules and she's not following them. And just a bad way to message. So that was the lesson learned there. Ottawa County, Michigan. That was, a lot of the places we went were bigger than us. This one wasn't. And they really do things well. They have a communications coordinator like we do, and they have a plan, and their leadership understands branding, and they have their kind of device to remember what's important to them around the 4 C's. And so I would say, figure out some way to make sure that you know how to tell the story and pass the story on to others. For them, it was the 4 C's about clear and creative and customer focused and all of those things. Spokane, Washington was our next stop, and there it was about connect the problem to people and connect the dots for folks. And they told the story about neighborhood improvement and describing the problem through the eyes of kids, and that was the way to create power around a message with their city commission. Billings, Montana was kind of unique. It's It's a health department that's also a federally qualified healthcare center, and when they created that kind of joint venture, they actually hired a professional media company that took them through a complete and pretty robust branding exercise. And part of what they took them through was what I was started with about values. You know, they didn't start with well, here, what do you think of this tagline, or what do you think of this commercial? It's, what are your values? What is the nature of the business that you're in? So they walked them through a values formation exercise and a what is your purpose exercise, or what is your business. They framed their business as, our business is making connections for people, and then all the rest kind of flowed from that. So that Flying Horse Communication was the company that they used, and I think this is where, what business were they in, all of that I just kind of talked about. We went down to Austin, Texas next. They said, branding isn't really, or rebranding isn't really what we're about. Producing good videos is important to us. We'll invest in that. But we're really focused on just doing a good job and kind of sticking to purpose around community engagement, and then letting that community work, community story flow from their own. So I don't know that was a place that connected a lot with what we were trying to get for the kids, but as I was sitting here at the beginning of the semester trying to identify places that I thought would tell a good story, it's kind of a shot in the dark sometimes. Maricopa, those kids really liked that place because they really loved Marcus's story about, that you teach someone to fish and then they can feed themselves, but if you haven't created the environment around that person to be successful, i.e. the lake, then you haven't really gone the full measure. And so it was just interesting to me to watch these kids and see what connected for them as far as, oh, now I understand public health a little better. That fish and lake story just, had lots of meaning for them. So you never know, I guess, would be what I would say there, what connects with people. At the end of the day, this was kind of a high-level representation of what their advice to us was. At the top was, here's your current brand, that we're a trusted source of information and that we provide good healthcare services to people in lower SES populations. And what you've told us you want your brand to be is, we're a trusted source of information, working in the community, or in the clinic and our community, to keep us healthy. And so how might we do that? Their recommendations were connect, push out information, push out messaging around how to have a healthy and active lifestyle. And I would have to say, when I look logically at the challenges in health in Lawrence and Douglas County, I struggle with that one because that one isn't going to drive equity for us. And we need to focus on affordable housing. We need to focus on good jobs and poverty and getting our graduation rates up. But it's also about what does the public, the public perception, and how do you set a public brand. Sometimes means you have to craft the message in ways that maybe aren't, as true to how you would do it in your own little world than you like. And then, of course, sticking with that we're a trusted source of information, that we push that out to. And then they said, do that in these 4 ways: digitally, through media, and that earned media that we do, work through partners, and then direct campaigns. Then they put together some specific ideas, and this is really hard to read. In fact, it's fuzzy and I can barely read it. But I would say, so redesign your website, push out more YouTube videos, adopt the Healthier Together tagline, push out a mobile app, host town hall meetings, increase infographic use. You know, we did all of those things. And at the time, I think this was like 2 years ago, we said, well, these things check the box on, collaborate with schools. We're starting to do this work, co-branding our logo. One of the things we did was a Fuel Good logo, where we got Bill Self as the basketball coach at KU, and there's no bigger presence in Lawrence than Bill Self. And so he put together some commercials for us to push the Fuel Good logo, which was something that we did in partnership with the city of Lawrence to try to promote a healthy vending policy that we had worked with the city to adopt. So it was about making healthy choices, and you could do that by looking for the Fuel Good logo. And by the way, our health department logo was right there with it. And pushing that out in grocery stores. Co-brand with Market Match, which was a program that I think a lot of communities have now done, where you go to the farmer's market and double your SNAP benefits through the Market Match program. So we help push that information out. You know, we help promote it, and we co-brand with it. Just a whole bunch of other things, even down to refresh the look and feel of your waiting room. So that's where we're at right now, is putting that together, because we want that to say you're welcome here, we respect you, that this is a welcoming, inviting place. Who does this work? I think I'm out of time, aren't I? We're pretty close. Who does this work? I think it's obvious. My answer would be everyone. Do you need a point person? Maybe. You definitely need that point person behind the scenes that will motivate you and push you to make things a priority and be responsive to the media. You also need a point person to create those ways to be able to tell your story quickly and simply. I wanted to end really quickly, because the biggest branding challenge I thought we had, going back to the city manager not wanting to fund us, was we wanted to embark on this change of what we are about, this journey from clinic to community. And if we didn't tell that story, and if the community didn't understand why that change was important and needed, then we were setting ourselves up for future challenges. We had to stay connected with our base, with our community, and so we needed to make sure that we told a story about why did we choose to become accredited that wasn't about, well, we wanted to see this plaque and use the seal, but this was about making sure we could do right by you, the community. So that's, I hope, what you'll see in this video.
Good morning.
I think that we're in the relationship business, which means that we need to understand what is impacting the health of our community and understand who we need to be working with to improve our health.
When I think of the public health system, I think of the entire community.
We're really about trying to improve the health of all of us here in Douglas County.
I remember the very first day I walked in and talked to staff, and I said to them, our focus isn't the 20,000 people who walk through our doors, but the 110,000 people that live in Douglas County. So we've been working ever since to make sure that our focus is on the 110,000.
We've got a lot of supportive partners, active partnerships, active coalitions that really are enthusiastic and engaged in the work of how to make this a healthy and more vibrant community, and it's really rewarding to have an opportunity to be part of that discussion in Lawrence and Douglas County.
Every day we are doing things that help to improve the health of our community.
And that's always what I wanted to do, is do a job where I'm contributing for the better good of the community.
I've been in public health for over 22 years now, and I just really like being able to help families become better functioning families.
Although I see a lot of sad stories, I feel at the same time like I'm giving back and making somewhat of a difference, even if it's just in one person's life for that 1 month or year.
I think we're improving the health of the community in various ways now. Public health is changing.
The place to treat and prevent chronic disease isn't in midlife in an exam room with your physician. It's as a young child in your community, in your school, in your neighborhood, in your home, working to create healthy behaviors that'll last a lifetime.
The health issues in our community are big. They're not issues that that just those of us that work in public health are able to tackle. So when we work together with our community and we're all focusing on the same
Great. Look
outcomes and the same goals, we're a lot stronger together.
You know, I think there's a lot of efforts now outside the doors of the health department where we're engaging a lot of different people in the work of increasing, you know, better health for our community.
These challenges are too big and too daunting for any one agency to solve. It truly takes a system approach, a partner approach to make these things happen, because we have big dreams, so we want to achieve them. You know, I'm really proud of that video, and what I'm proud about is we didn't script that for staff. The cameraman just set it up, asked them a question, and they went. And you know, that's a fair percentage of our staff, and they all had our story down. I think that's really the thing I would ask all of you to try to do where you work is if you can all have that shared story, you're gonna go a long ways.